Now, today we are delving into a topic that often sparks heated debate but desperately needs understanding: the perceived clash between psychology, the medical industry, psychiatry, and the Bible where it comes to mental health. It's a divide that, frankly, can cause more harm than good. Even in our own community, we see an increase in mental health issues, suicide, and mental agony. I can attribute many of these problems to fear, anger, guilt, and greed, not to mention social standing in the community and the negative connotation that any intervention on any mental health plane has, especially for men. So, for far too long, many have been told that they have to choose. Is your struggle a medical issue? Is it solvable with therapy and medication? Or is it a spiritual one requiring prayer and faith? Now, this creates a false dichotomy, suggesting that these parts are mutually exclusive and even at odds. And in this mad world we live in, that kind of thinking leaves so many people feeling lost, unsupported, and incomplete. Now, let's be blunt about the negative impact of an extreme spiritual only approach. And I'm going to discuss the two and the pros and cons as I see it as we go along. So, we've seen recognized concerns, especially in some conservative or charismatic denominations, where mental illness is tragically stigmatized. It's attributed solely to spiritual factors like sin, lack of faith, or even demonic possession. Now, this perspective can lead to genuine harm, and I want to mention three of those. The first one is mistreatment. Offering ineffective religious remedies that completely fail to address underlying psychological or medical issues is a problem, or it can cause confusion. Imagine someone with severe clinical depression or bipolar disorder being told they just need to pray harder rather than seeking a therapist, a doctor, a counselor, or a psychiatrist. The second one is the reluctance to seek professional help. Actively discouraging medical or psychiatric or counseling intervention in favor of spiritual healing. That means prayer, anointing, or even exorcism, which can leave severe conditions untreated and even make them worse. The third one is psychological harm. Fear and control based religious teachings that don't just neglect pre existing conditions, but can actively exacerbate them or even create new mental health issues in vulnerable individuals. This isn't healing. This is often spiritual abuse. And we have to take responsibility for the people in our care to make sure that they are not abused in any way. Now, the problem with secular only approaches, on the flip side, is while they are invaluable in its scientific understanding, can sometimes miss a crucial dimension. Psychology, the medical industry, and psychiatry offer incredible tools: therapy, cognitive behavior techniques, and medication that literally can save lives. But for many, these alone don't ask or answer the deeper questions of meaning, purpose, or help with a deeply spiritual struggle. If we view medication and therapy as the only alpha and omega, the complete solution to all problems, we might neglect the profound human need for spiritual connection, community, and the existential understanding that faith often provides very important support. For some, reducing all the stress to brain chemistry or learned behaviors without acknowledging the spirit can leave them feeling disconnected from a deeper sense of self or meaning. So, where do we go from here? The solution is not to demonize one side or idolize the other. To be truly healthy, to truly thrive in this mad world, we need to embrace everything that can keep us basically sane, whole, and connected to ourselves, our community, and the world at large. So we shouldn't look to either psychology, psychiatry, or the Bible as the sole solution to solve our problems. Imagine a world where a person is struggling with anxiety can openly share their feelings with their pastor, their dominee, their religious leader, who then encourages them to also see a therapist or a counselor or a doctor. Imagine a counselor, a psychologist, who understand the patient's spiritual framework and incorporates it respectfully into their treatment plan rather than completely dismissing it. The Bible at its core speaks to human struggle, suffering, hope, and the need for community and a loving God. And science, through psychology and psychiatry and medical intervention, offers profound insights into the human mind, its vulnerabilities, how it works, how brain chemicals, how neurochemicals work. And these are powerful tools for healing in the long term. These are not opposing forces designed to tear us apart. There are different lenses, different tools, all given to us to help navigate the complexities of being human. So my request tonight or today is to let's commit to fostering environments, inclusive environments, multidisciplinary environments, both in our faith communities and our healthcare systems, where integration is celebrated and not condemned, where seeking help for a mental health issue is seen as a sign of wisdom and strength, not a weakness, and where faith can be a powerful support to healing, but not always a complete replacement. What are your thoughts on this? Have you experienced this divide? Are you in a struggle to decide whether you should rather go to the doctor, whether you should go to church, whether you should read more the Bible? What should you do? Should you see a counselor like me or whoever in town? How have you found wholeness in your life journey? Please share your perspective in the comments below. I would really appreciate that. Now, next time, I'm going to talk about the Exodus diet program and my views on it as I see it and how I understand it. All right, have a lovely evening and day tomorrow, and we'll speak soon. All right, bye-bye.